Hi, I'm Dr. Albert Balge. I'm a clinical health psychologist. This segment of Coping with COVID-19 is about what information you should be paying attention to. One of the very first things I discovered after I became a health psychologist is that some medical patients who are facing a serious illness or a threatening diagnosis will try to read absolutely everything that they can about that illness. They will look at videos, they will read everything that's available online, and they will often find themselves much more anxious as a result of that. They'll notice relatively minor symptoms that they're experiencing and overinterpret them and think that their illness is much worse than it actually is. There's another group of people, of course, who do the opposite thing and say, don't tell me anything. I don't want to know anything about my illness. Just tell me what to do and I'll do that. And of course, that doesn't work very well either because they're often unprepared if their illness takes a long time and there are various issues they need to cope with along the way. And they're also very likely worrying about it, even if they're not consciously paying attention to the information. So what I've discovered is that the very best thing that you can do in terms of the information that you need is to find out what is important for you to take meaningful action about the medical situation that you're facing. Expose yourself in our current situation to the information that's necessary to keep you safe. So what is social distancing exactly? What does it mean to avoid large groups of people and crowds? How do you make sure that you wear a mask properly? And what kind of mask is useful and actually effective? What's the best way to wash your hands? Those kinds of things are really important to have a good understanding of and a mastery of because they allow you to do things that really make a difference. Other sorts of information are probably important too, like what is the course of the disease nationally and internationally and in your own community? How are things going? What is it looking like in terms of the time that we'll be able to have to pay less attention to these mitigation strategies that minimize our chance of developing the illness, and to make the proper plans in our lives to stay the course and be able to survive well. Other information, not so important. The partisan political information that's very common out there, not really necessary. The information that's either dismisses the risk of COVID-19 or makes it extremely scary. You don't need to expose yourself to that. And to set that aside and make good choices to help you keep your peace of mind during this time is perfectly appropriate. I think another thing to pay attention to that will help you to do this is the form that you get your information in. It's all about making choices about the information that you are going to pay attention to. So when you have something printed on the screen, let's say, or in a newspaper, you can make choices about looking at this article or that article and not looking at another article that isn't of so much interest to you. So you're actually making choices of the information you click on. If there's a live stream going on, though, let's say there's a news broadcast or a news briefing or something like that, does not give you a choice. They've already made the choices about what you're going to be exposed to in terms of the information, and you don't have a choice about that. Your only choice is yes, no. Continue to pay attention or not to pay attention. And my suggestion is that you make your viewing of online news and television news as minimal as you can. Pay attention to a few things that you think are important, but don't just leave the TV on 24/7. All right. So the bottom line message here is be thoughtful about the information that you read and that you look at, and pay most attention to the things that will allow you to take meaningful action to keep yourself safe and to get through this illness threat in the best way that you and your family can.